Berkshire County residents are, to be frank, older. They're older than almost all areas of Massachusetts. People 65 and older outpace those under the age of 18. Looking to help the region prepare, the Berkshire Regional Planning Commission has been studying how to make homes, businesses, and the community more age-friendly. I sat down with Laura Kittross to discuss the issue.
We really were brought in by Bobby Orsi at Home Instead Senior Care, who had been reading about Age Friendly and was recognizing, as many people do, that the county is aging and that there's a great deal of the population is really growing that's over 50 and over 65. And Berkshire Regional Planning Commission had also been looking at the loss of young adults in the county. So these seemed like two sides of the same coin.
Yeah, it made sense to dive into it. Let's look at some of the numbers. Across the country, it's predicted that by 2030, approximately 1 in 5 will be over the age of 65. But then when we look at that information in the Berkshires is kind of already there, right? When it comes to people who are 65 and older, they outpace those who are 18 and younger. So with that knowledge, is that why the county was accepted into the Age Friendly Communities program?
So I think that, we were accepted into the Age Friendly Communities program simply because we made a commitment to becoming more livable for older adults, more age friendly for all ages. But certainly that was our impetus was, oh my, look at this. We really have this dearth of young adults and children as a result, and we have this growing number of older adults. So let's look at this as an opportunity. But let's look at these demographic changes as something we really need to pay attention to and make sure we're ready as a county.
And what does that readiness look like? What does the Age Friendly program sort of help you plan for and look at?
So Age Friendly is all about making the community more livable. And it's about making the community more livable for all ages. Really, if you can make it work for the very young and for the oldest, it works for the rest of us in between too. And it's looking at things like walkability, like transportation, civic engagement. These are things that people of all ages are really interested in and that we want to look at for older adults as well.
And it's interesting around the issue of walkability. You think like, oh, it's the Berkshires. There's lots of places to walk. But then when you actually start thinking about, okay, what are some of the mechanics that need to be in place for someone to feel safe walking, who might be a little unstable on their feet, the first thing you think about is sidewalks, right? And there are a lot of Berkshire County communities, especially when you get into the smaller towns, don't have those sidewalks, right?
Right, so sidewalks is a big one, and sidewalks that are in good condition. And you don't want people walking in the shoulder on roads where people aren't expecting to see pedestrians. Sidewalks are expensive. We have Complete Streets project and so on that people are looking at things like sidewalks, but maybe there's cheaper fixes or easier fixes. Maybe there's some things that we can do around walkability and getting places that don't involve, $1 million sidewalk project.
Yeah. One of the things that Berkshire Regional Planning has done in its process of looking at aging in general is you put out a survey, right? Mm-hmm. And it was of about 2,400 residents, and the vast majority of those who took the survey said that staying in their own homes as they age was extremely important. Were you surprised to find that from the survey?
We expected actually to see higher numbers of people who said it was more important to them to stay in their own community. And we did find most people found that very important, but even more striking were the people who said, no, I want to be independently in my own home for as long as possible. And we also had a lot of people say, I'm afraid I won't be able to. So we did a number of follow-up activities afterward to find out, well, what are the barriers to staying in your own home?
And to that point, what are those barriers? I mean, there are obvious ones, right? Like stairs. Stairs will probably be problematic as we age, or could be. But what are some of the other challenges to having an elder stay in their own home?
So there's a lot of things you can do to adapt your home, to retrofit your home, to make it easier for you to stay there as you become less stable on your feet, and so on. You can remove trips hazards. You can put bars up in the bathroom. You can, if possible, move some things down in your kitchen to make them easier to reach and so on. It just gets hard to change a light bulb over the stairs. It gets hard to shovel the snow. It gets hard to do your gardening.
Asking for help or maybe bringing in some additional help?
Exactly. And, there's expenses as you grow older. People are on a fixed income. property taxes keep going up. So just knowing about help that's out there, knowing about programs, whether it's asking your friends and family for help or whether there's social service or government programs.
Yeah, because a lot of times I think it is, as I was reading in the report, it's not necessarily a lack of available assistance.
Right.
It's a lack of communication a lot of times, at least is what the report pointed out. Another thing that jumped out is the fact that elders are saying, we'd like to stay in our homes, but then maybe adult children are saying, well, you're not capable of staying in your own home. How do you open up that line of communication between adult, child, and parent to have that dialogue?
It's a really good question, and I think a lot of us are in that position with our parents as they get older or with our children as we get older. Yeah, children want to make sure their parents are safe and they're taken care of, whereas I think as we get older, we value our independence and really want to stay in our own homes. I mean, all I can suggest is that you have that conversation, it's an open conversation, and that you try to become aware of what help there is out there and make sure that the people who care about you understand that you're aware of this and that you won't do anything foolish.
The World Health Organization has some tips or sort of a spectrum that they look at in terms of 8 things that they believe will help with the aging process. And a few of them are housing, respect and social inclusion, employment, which I thought was interesting, yes, or volunteerism, and transportation. To me, in the Berkshires, transportation is probably one of the biggest challenges. Is that what you found through your research?
So transportation's a huge issue. Anytime we do a public forum, people mention transportation. Large number of our older adults continue to drive, even among the very oldest people in their 80s. The vast majority are still driving. Transportation's always a big issue in rural areas because you don't have the density to make it cost effective.
Public transportation cost effective, yeah.
Right, so we're looking at a number of options to try and encourage. We wouldn't necessarily do them ourselves, but the on-demand systems, the Ubers and Lyfts, and that kind of, or maybe there's a Berkshire alternative to that, or ride sharing, volunteers driving, a number of different options that might make more sense than fixed route public transportation.
The report also pointed to the need for senior sensitivity training. Has any of that begun?
So yeah, so we've seen some of the businesses have done some training, particularly around recognizing people with milder cognitive impairment who may still be living in the community and may come in to do their banking. I know at our launch event next week, Greylock Savings Bank, Greylock Credit Union will be coming in to talk about them doing that. Some of the towns have done that. The Adams Public Works Department did a sensitivity training. And I think there's some things happening in the EMS world, the ambulance world, and so on. That's certainly something we want to continue with businesses and make sure that people have had that training.
Great. What's next for the process?
So next is the actual let's work. Let's get down and try to start doing some of these things that are in the plan. Like you said, there's a lot in the plan, a lot of things that we're looking at doing. Clearly, we're not going to do all of that. That's something where our partners need to come to the table and let us know, what are you already doing? What could you be doing now that you know about Age Friendly and that could be made with either no additional resources or relatively few additional resources that you could do that would make things more age friendly? And then if we had resources, if we had money, if we had expertise, what else can we do? It's also going to be going out to some of the different municipalities and saying, here's a checklist. Here's some of the things you could do as a municipality to make your town more age-friendly for the people who live here. And then there's some really much bigger issues like housing. How can we make more age-friendly housing, more apartments, more condos, mixing a residential into commercial areas and so on, zoning changes. That will take a lot longer.
Well, great. Thanks for coming in.